My name is Dr. Travers. I'm a joint surgeon at University of Pennsylvania Hospital System, specifically Pennsylvania Hospital. So I specialize in orthopedics with a focus on joint replacement, specifically knee and hip replacement. There's a lot of questions surrounding COVID. Penn Medicine Orthopaedics is taking a lot of precautions. So everyone who enters the hospital must be wearing a mask. We're limiting the volume of patients we're seeing, both in the office and in the OR, to make sure that people aren't accumulating in waiting areas. We're also screening everybody that has surgery with a nasal swab test to make sure that nobody is COVID positive. And this goes for our staff as well. Every staff member who enters the hospital has their temperature recorded and a questionnaire completed to make sure that they aren't experiencing any COVID symptoms. As far as what patients can do to manage joint pain and inflammation during the pandemic, these are things that I recommend to anyone who has an injury or joint pain. Specifically, something called RICE, which is an acronym for rest, ice, compression, and elevation. So if you have, for example, a painful knee joint, you can put ice on it at the end of the day, rest, put your feet up on the couch. You can even put a compressive ACE wrap on, and that can help a lot with joint pain. So a lot of patients have been asking questions regarding NSAID use, which is things like Aleve, Advil, and if it can cause a worse COVID infection. There was a paper published in early March in The Lancet, which is actually just an opinion piece, which they theorized that things like ibuprofen could cause a worse COVID infection. There has been no evidence to date that that's the case, and that's very much up in the air. So there's been many literature reviews, and there's no significant evidence that things like Advil or Aleve are putting people at an increased risk. So as far as at this stage, I am still prescribing that to my patients for joint pain. Those who are very concerned or higher risk can also take Tylenol, which is a different type of medication, can also help the joint. But at this point, I'm not overly concerned that that is a significant risk factor for severe COVID infection. So a lot of patients ask, what can they do to avoid joint pain flare-ups or worsening of their joint pain during this time? And really what I recommend is modifying activities that you do that do cause pain. So, and that really is focused on minimizing stress on the joints. So specifically, for example, knee pain, sitting in really low chairs where you have to really bend your knees to get in and out should be avoided because that can cause worsening knee pain. Long distance walks or runs typically are more likely to cause pain than shorter distance walks or runs. Things like deep squats or kneeling, anytime when you're really doing an extreme range of motion with your hip or your knee joint, are at higher risk of causing pain. So I tell people to try to modify things they do. They have a specific activity that really bothers them, try to modify in such a way that it's less stressful on your joints. It requires less severe range of motion. You know, a lot of us are at home. We're maybe not exercising as much as we have in the past. And obviously, eating habits have to be maintained. So monitoring caloric intake, trying to maintain weight is very important. Specifically for joints, small changes in weight, either up or down, can have huge effects on the amount of force a joint sees. So, for example, with your knees, every pound you gain is about 6 times that on the knees, specifically going up and down stairs. So even a pound lost can be something to be proud of, and that will definitely help with your joint pain. What kind of exercises can I do at home to keep my knees and hips healthy? And specifically, there are some exercises that target specific muscle groups in that area. So one of the most important muscles for hip and knee health is the quadricep muscle. This is the muscle in the front of your thigh. So things that exercise that are extending your knee or straightening your leg out. So if you're sitting in a chair and you straighten your leg out at the knee, that is working your quadricep muscle. And keeping that strong is important for posture, gait, and strength. Focusing on the hips, you can also strengthen your hip flexors and your core muscles. So hip flexors are the muscles in the front of your hip that lift your leg up off the ground. So if you're laying flat on a bed, you can lift your heel off the bed as straight up as far as you can, and that'll be working on your hip flexors. And that will give you a good exercise and good strengthening around that area. All these exercises for the knee and hip health can be done at home. They're typically low weight, low resistance, so you don't require any kind of weight system or exercise machine. And it's really just using gravity and using your own body weight to try to gently strengthen those areas. So I'm not recommending going out and buying really heavy weights or doing anything really extreme. This is more just laying down on the floor and lifting your leg up off the ground, or even sitting in a chair during commercials and straightening your knee out and trying to do a little bit of strengthening of that area. For patients who do need care during the pandemic, Penn Medicine Orthopaedics has multiple options. So specifically, most people are going to be seen initially through a telemedicine visit. What that means is either a phone call or a video visit with a physician or physician assistant, where we discuss your problems. We decide what needs to be done next, whether or not we need to obtain x-rays, start therapy, bracing, things like that. So we do have services available that can help during this time without any contact at all. For those people who do have significant injuries or do require more in-person care, we do have clinic slots available for emergency and urgent issues. Going forward, we will slowly reopen the clinics and make more spots available for less urgent problems. And that is a day-to-day decision. So we will keep our patients updated as to what slots are available and what the best option is for them. Probably the best thing to do is to call Penn Orthopaedics and schedule a telemedicine visit. If it is something that you do need to be seen for, we can always make a spot for you and have you come into the office. But most problems can be initially dealt with via telemedicine, and it's probably the safest for everyone. And we're trying to go through every single patient that we take care of and look at those risk factors and determine how high risk they are for surgery. And then by looking at them each individually, we can decide when is the best time to proceed with surgery, and who needs it the most, and what the best way to proceed is. We're going to be taking multiple precautions, and the clinic and OR will not look the same as it did before the pandemic. Specifically, we're going to be focusing on preventing large groups of people from gathering, so that will mean less visits and no waiting in the waiting area. So people will be roomed immediately, and there'll be limited contact with staff, so as limited as possible. As far as the OR, the same thing applies. So we're going to be limiting the number of cases we do to prevent people from being admitted to the hospital, utilizing resources that may be needed for COVID patients, and also just preventing our patients from coming in contact with more people during this time. This is obviously something that's never been seen before. And I think everyone's been doing a great job of social distancing and maintaining safety. The patients I have spoken to are doing very well and are taking care of themselves. And I just want everyone to know that Penn Medicine Orthopaedics is here for you. If you have any kind of problem, even if it's not orthopedic, get in touch. We can always put you in touch with the right physician or provider, and we're here to help.